There's a really interesting public health mystery playing out in Germany right now. You see, the country has poured a ton of effort into hundreds of programs to get people more active. But despite all that, a huge part of the population just isn't. So what's going on? Why are all these well-intentioned efforts not quite hitting the mark? So here's how we're going to crack this case. First, we'll get a handle on just how big Germany's inactivity problem really is. Then we'll look at all the things being done to fix it. That's going to lead us to two very different kinds of programs, which is where we'll uncover a huge paradox. And finally, we'll look at the game plan for moving forward.
All right, first things first. To really understand the mystery here, we need to get a clear picture of the stakes. Just how widespread is this inactivity problem?
Well, the numbers are pretty staggering. More than half, over 55% of German adults aren't meeting the basic physical activity guidelines from the World Health Organization. And that's not just a statistic, that translates to real health risks for millions of people and, honestly, massive costs for the country down the road.
And it gets even more interesting when you start to break it down. It's not an even split. You can see that women and girls tend to be less active than men and boys. And look at what happens as people get older. The activity levels just plummet. The data also tells us that folks with chronic illnesses are some of the least active people of all. But the story doesn't stop there. The research is really clear on this. This isn't just a health thing, it's a social issue. Activity levels are consistently linked to things like a person's income and how much education they have. So what we're looking at is a really complex, tangled challenge. So with a problem this big, you'd think Germany is throwing a lot at it, right? Well, you would be absolutely correct. The response has been widespread.
In fact, researchers found 131 different programs all aimed at getting people to move more. And these aren't just tiny local projects. We're talking initiatives in schools, in workplaces, in communities, all across the nation. So there is definitely no lack of effort.
Which brings us right back to the central puzzle, doesn't it? With all of that energy, all that investment, and all those programs running, why are the overall numbers still so low? Why isn't the needle moving?
To get to the bottom of this, we need to look closer at those 131 programs, because it turns out they're not all the same. Researchers sorted them into two main buckets, what they call good practice and routine practice. First, let's talk about good practice. Think of these as the gold standard projects. They're the ones that have been put under the scientific microscope, they've been tested, and we have the cold, hard data to prove that they actually work, they get results. And then you've got routine practice. These are the giants, the huge nationwide programs that are just baked into the system. Things like PE classes in schools or corporate wellness programs. They reach a ton of people. But here's the catch. We don't really know if they work. Their effectiveness has almost never been properly studied.
And this comparison just lays out the core issue perfectly. On one side, you've got these smaller, often shorter-term projects that have proven results. On the other side, you have these massive, long-term programs that reach everybody, but their actual impact is a giant question mark. And this right here, this leads us to the heart of the entire mystery. It's something the researchers call the effectiveness reach paradox. And this is the big reveal. Let's start with the data on reach. If the question is, who's reaching the most people? Well, it's not even close. A full quarter of those big routine practice programs reach over 100,000 individuals. That's more than double the good practice projects. So they've definitely got scale, but do they have results? Because when we ask that question, which programs are actually proven to work, the whole picture just flips upside down. By definition, 100% of the practice projects have the data to back them up, and the huge routine practice programs, only 11%, a tiny fraction.
So here it is, the paradox in a nutshell. The programs we know work aren't reaching enough people. And the programs that are reaching tons of people, well, we have no idea if they're actually working. And this single issue could explain why Germany's progress has pretty much stalled. Okay. So we've diagnosed the problem. Now for the million-dollar question. What's the solution? How does Germany break out of this paradox and start making some real progress? Well, the path forward is pretty simple in concept. You've got to combine the best of both worlds. The goal is to take the proven, effective methods from those good practice projects and somehow give them the massive scale of routine practice. The study suggests a clear three-step plan.
Step 1, find the small-scale projects that are knocking it out of the park and figure out how to make them bigger. Step 2, start seriously testing the big, existing programs to see what's working and what's not. And step 3, which is absolutely key, get the researchers, the policymakers, and the people on the ground running the programs to actually work together.
And this isn't just an idea on paper. There's a major, concrete step being planned to make it all happen: creating a national competence center for physical activity promotion. Think of it as a central command hub to coordinate everything and bridge that gap between science and real-world practice. And when you zoom out, this paradox and journey really leaves us with a critical question that applies pretty much everywhere to any public health challenge. It's not enough to just do things. The real challenge is this: how can we make sure that the solutions we know for a fact are effective are the same ones reaching everyone who needs them?